Alright, I just want to restate the main issues that we have with universal health care. First of all, when you have free Medicare or any type of medicine, of course you're going to need, like my partner said, there's going to be more supply and demand. So of course, when you have more supply and demand, you're going to need to find any way how you're going to pay for all this medicine, especially when it's free, or if citizens don't have to pay for it. So with this, of course, the United States, the first thing they want to think of is taxing other fields or start cutting costs. So yes, they might think about cutting costs from the budget from education or defense. At the same time, they might want to think about taxing other things such as more tax on food, gasoline, or any major tax that we already pay right now. So right now, we don't want to think about imposing or making things harder for the United States citizens, especially for people who work hard and make their money a decent way. And at the same time, you don't want certain citizens to take advantage of free health care because, like from earlier, they don't want the United States or the government doesn't want to see all the money that they put into all this medicine for people to get cured of cancer or whatever medical issues that they have. They don't want to see that go to waste. And plus, with this, you're going to have more government running and telling what to do in the medical profession. So with the government dictating what each healthcare, whatever policy or private owner, what to do, then that tells them they have the right to tell you which, tell what patient, what medicine they can have, and telling what doctors which patient, depending on their medical history, because they know that since you're in a database, that gives them the right to say, you know what, don't even give this person any medicine because based on their background, they do not have, it seems that they're not taking care of themselves. So with this, the government is going to force more programs also to help fund, to make sure that you do any fund or any fundraisers to make sure that you prevent yourself from causing yourself any harm to your health. So that can be coming from either imposing more laws on how much you can smoke or drink. So with that, the United States and the government, people, supporters do not want to see that happen. At the same time, like my partner said, in the medical field, you do not want, the doctors do not want to take all that time and study just to make minimum wage or minimum wage as a person that is in like maybe the auto business or whatnot. They take their time seriously to make sure they can find research in different medicines to help treat different cases such as cancer. So with them thinking, oh, you have free Medicare or free medicine, people are going to think they're automatically going to get it, and at the same time, with no with no money coming into any private or any medical business, then that's less money to flow around for any workers that or doctors in order to conduct any treatments for any patients. So with this, universal health care does not need to be instated into the United States because it has flaws of itself. It's not going to be a perfect health care either.